Hello everyone, welcome. So today we were about to adjust him and I stopped him in mid-sentence and asked if I could film this because this is really important. If you have a senior or your parents are seniors, grandparents, you know a senior, you have a senior that you love, that's everybody, okay? You're going to want to watch this video because I have been treating, can I use your name? Or you want me to use a fake name? Okay, so Al here this is our third visit, and he came to me pretty desperate, had some injections from the rheumatologist, has a lot of hip pain, doesn't play tennis anymore, switched to golf. It's affected your life, your lifestyle, right? Yeah. So he's, incrementally better in 2 visits, but that's not what this is about. What this video is about is I was doing a lot of ART on his hip, and that was helping him the first 2 visits. And now we're going into some instrument-assisted soft tissue instruments. And these are IASTM equipment. That's the acronym they use, instrument-assisted soft tissue mobilization. And as I'm doing that, sorry, Al, I got to show your butt, but sorry, ladies, he's married. But see that right there? Big bruise. Don't worry, you don't need to see it. A big bruise, okay? And I said, Al, what happened? You have a big bruise. He said, oh, yeah, I forgot to mention. This happens all the time, not just with people his age, 60 and plus, but even younger people. It's important to tell your doctor if you had a slip or a fall, really important. And a lot of times we forget. He's got a nice bruise right there. I stopped using this right away, and we'll explain why in a second, but he has this big bruise right there, and then he told me what? Go ahead and...
Well, I was trying to go to bed, and I shut off all the lights in my apartment, and I realized that I had a chair in the way, and I fell off over the chair and literally took a nosedive into my wall. And I know my toe was bleeding on the same side, my right leg, and as a result, I've had this pain in my knee ever since. And I think it's a result of falling over the chair and then falling towards the wall.
Did you hit your head?
I didn't hit my head because I was very careful about not hitting my head because I had a head accident about a year ago. So I was very careful about that.
So another issue, I'm going to do a video on this, is stability for seniors. It's so important. Hip fractures are one of the deadliest. They're the deadliest type of fracture in a senior, and they happen a lot. So stability, making sure that you have good stability and balance is key. And we'll do another video on that. But today we're going to talk about just telling your doctor when you fall or slip. It's really important. So I have to add that to his notes clearly. And Medicare wants to know all of this. I want to know all of this. And so we can treat you the best. So now I stopped using the Graston technique, which, I didn't know that he had that recent fall, and he came to see me less than 3 weeks ago, right? So you saw me right before I left for vacation.
Yes.
So wait a minute. Did this happen after or
No,
before?
It happened before you went away. It happened about 2 weeks before.
2 weeks before. So it's amazing. We forget short-term memory. I have an awful memory. Awful. I've had multiple head traumas myself, so I do not rely on my memory. So sometimes it's good to come with a friend that's close to you, a spouse, a loved one, a girlfriend, boyfriend, someone that lives with you that knows, about all your slips and falls and old injuries that you may be forgetting when you're in the doctor's office. Really important to do that. History is key. So today what we're going to do for Al is cold laser therapy. So I'm going to I already know where the areas of inflammation are where he has bruises. So let's test this machine out. This is a MR5 Active Pro laser with laser stim. And what this can do is it can find areas of soft tissue damage, and inflammation. So it should beep right over the bruises, obviously. And we will check it now and test it. So, okay. So. And we're going over the bruise right now. There we go. It beeps. So detected inflammation right over the center of the bruise, but the outer part is healing. It's had 3 weeks to heal up, I guess. Did you ice it afterwards or do anything?
I have iced it from time to time, not consistently, but
So
where I have used the ice is on my other leg because that's where the bruises, I think.
On the knee?
Right on my knee of the other
okay.
leg.
So for a chiropractor, do you think this is important to know that he fell over a chair? Yes, right? So, and he has a bruise here. So that means his hip here, his leg, right below near the trochanter, hit something, right? He had an impact here. Whether it's the floor, the chair, what's next to the chair, doesn't matter. But that is really important for a chiropractor, and it also tells the direction of impact. So a chiropractor can better assess the direction of correction that they need to do. Really, really important. I'm glad I pulled his pants down. It's kind of weird, but you know, I'm glad that we did this technique and checked, because when I did ART, I did it up here. I didn't do it all the way down there.
When I fell off the chair, the next thing next to the chair was a table. And I think I hit that part of my body against the table, and then trying to protect my head.
And it's beeping right over the
ace of my right foot and put my hand up against the wall.
Okay, so you braced
both sides.
So you prevented your head from hitting the wall by putting your hand out. So it beeped right over the joint, the hip joint. He's also had other falls previous to this, so this just adds to them. So clearly there's a balance, there's a stability issue here. We're going to do another video on that, and that's something we're going to have to work on. Otherwise, you're going to have to walk with a walker your next fall, you know. And I have a 92-year-old father who's now in between a walker and a wheelchair. God bless him. You know, I wish I lived closer to him and to treat him every day. That would be great, but that's not possible. So if you can get that good care for your parents, do it. Mobility, balance is everything if you're 60 and over. Okay.
I definitely have a balance.
And here we go. It beeped again. So there's some areas of inflammation around the bruise too, right around the hip joint itself. We might even take an X-ray if, you know, we're only on week 1. So if in 2-3 weeks it's not improving by about 25-30%, we may end up taking an X-ray of the hip and, you know, making sure there's no arthritis in there, okay? Given all the falls you've had, all right? So if you guys have any questions, feel free to comment below. I want to thank Al here for letting us just a public service announcement. You know, if you have someone that you love that's fallen multiple times, make sure they get some therapy to improve their balance and their coordination. Okay, so you're tender on the left side. Yeah, and you can see here my left hand is higher, so your hip is driven upward and forward on this left side, and hence this is also the side that you fell and hit. So, in the bad hip side. So we're going to correct that, and then we're going to do a little flexion distraction. So this is Thompson Technique, where the table pops up here. That's what it's called. It's a light force technique. Okay. And you notice I'm pushing down here. I'm being careful not to touch your hip, but your pelvis here. So, okay. Now, normally when I adjust the pelvis like this, that's forward and higher, I adjust it down low. But because he had trauma down here, we're going to adjust it
that I can feel.
from up here. And then we're going to do a little flexion distraction on you, okay? So now do you notice a difference?
No, I'm not sure.
Okay? They're much more balanced now, your hips are. And we're just going to adjust your sacrum here.
If you touch the same spot, I could be able to tell you. It's a little tender.
Yeah.
Nothing.
So we're going to go ahead and laser him right through here, reduce the swelling, reduce the muscle spasms, and just speed the healing process up for him. So we're going to put 2 lasers on him. We already did one on the hip over the bruised area, right over the hip joint itself. And now we're going to get into the lumbar spine. Because he's had so many falls, I'm sure the lumbar spine is affected. This is a really great, safe, effective way to reduce muscle spasms and speed up the healing process of any soft tissue damage quickly. So as I said, we're going to sandwich just treat the low back with 2 different lasers, speed it up here because, you guys, time is money, right? You guys are watching this video and you don't want to watch me doing laser because it's really pretty boring actually to watch. There's nothing you can really see happening. If you could see what's happening at the cellular level, which I've actually done another video on, it shows how it affects the soft tissue at the cellular level. That's a pretty cool video, but it's an old video, one of my first videos I made actually. So Al, you're not going to even feel anything except you're going to feel better when you get off the table. This also, the depth I have it at is more on the surface where you have nerves, so it's going to inhibit the nerves as well, okay? And then after a few treatments, we'll change the depth of the laser that we're treating, the depth of the tissue as well. This laser over here is a little weaker. It's a 25 watt, so this one we won't change as often. I'm going to treat a little bit longer in that area. And we are almost done here. And then this is the spot where it was tender, right?
Yeah, it's not now.
Yeah. There it's not. That's where I lasered. There, it should be tender here. Yeah. That we didn't laser yet. And how about out here?
No.
Okay, so that's the last spot right there. And how's that?
No.
Good. That's where we lasered. This spot, though, we have not lasered. That's where it's still sensitive. Yeah. Okay, we'll get both spots then. And what's great is, you do a handful of these treatments in the course of a week or 2, and it really speeds up the process quickly. Unfortunately, Medicare and insurance doesn't cover it yet. It's slowly being covered by insurance companies for, I believe, carpal tunnel syndrome is the only thing cold laser is FDA approved for, which I don't see why it needs to be FDA approved to be able to have an insurance company reimburse you for or pay for it. It's an effective tool, a really effective tool for arthritis, soft tissue injuries.
I have a load of arthritis. My shoulder.
Yeah, even your knee. I can even show you the increased flexibility you would get in one treatment from your knee after you fell, and it's just incredible. We did a woman's knee yesterday, and the increase in range of motion was 30% in just one treatment. Her knee was all swollen. She's got a lot of arthritis. It's very effective for that. We have rentals, so you can take them for a couple days or a week if you want. Okay. All right, this is the last spot. Okay, now we're going to do some flexion distraction technique.
Is that a temporary improvement, or is that?
What's that?
Like, is that going to come back?
The laser?
What you just did.
No, I mean, it's going to last. It's a good question. It's going to last probably 24, 48 hours, but you want to build on that. It's not just going to be one laser treatment. You really want to do 5 to 15 treatments. 15 is considered one full session, right? You can do that over a week or even a course of 2 to 3 weeks max. But 15 sessions over 3 to 4 weeks would be fine. And that would, for most injuries, some people don't ever come back after that. We have one woman in her 70s, had one treatment on her knee, and it helped her immensely. We haven't seen her in 5-6 years. I saw her in the street recently. We've had other people that, depending on how much damage, if it's tri-compartmental, for example, in the knee, and it's in all 3 compartments, and they're close to getting a knee replacement, it's probably not going to last as long. It really depends on how far gone the joint is, how much degeneration there really is. Stage 1, stage 2 versus stage 3, and the only way that could tell us that is maybe an MRI or some x-rays of your knee and of your back and your hip, and we may end up doing that. We have x-rays here. We could take an x-ray of your hip and back here, but as far as MRIs go, again, I may send you out for all those tests soon, okay? But I am glad you're seeing some incremental change, and we're on our 3rd visit, so we've only treated you twice so far. That's good. You said 5-10% improvement? Or no, less? Okay, 5 to 10, good. And just relax. Take some deep breaths in and out. So you have facet joints here in the back of the spine, and then that's where the nerves come out, and the spine, spinal cord. So what we're doing by doing this action is spacing out the facet joints, opening up the discs, pumping them in a little bit, right? Back of the disc. And what's called foraminal gapping. So what we do is we open up the foramina. The foramina are the holes in which the nerve exits through the spinal cord out to the rest of the body. It goes through the foramina. You want to have wide open foramina. That's what commonly pinches the nerves in the foramina when the disc herniates or bulges. Okay? So the first 2 times you came in, your left leg was always short. Now it's even. That's great. We're just going to test this and bend the knees. How you doing there? Any knee pain when I do that?
No, but it feels good. It's a stretch, but
Okay. No knee pain?
not pain.
Okay. Tightness?
There is pain on my right leg, but I'll show you that when I get up.
Okay.
That is a result. That definitely is a result of my fall.
Okay.
So I think I hit both. It was quite a fall. I mean, I must have flown 10 feet in the air. When all I cared about was not hitting my head.
You're lucky not to hit your head. Take a deep breath in for me.
Mm-hmm.
And just relax your head to the side there. Yep. Good. And again, deep breath in. Okay. And lay on your back. Actually, before you do that, raise one leg as high as you can. Good. And the other one? Good. They're going up evenly. How does that feel?
Okay.
All right. Turn over on your back.
Show me how to get up the other day.
Yes, we'll practice that too. Today I'll show you how to get up.
Let me show you this first.
Turn over on your back first, though, okay? Just lay right on your back.
All right. This.
Yeah?
If there's a spot right here.
And put your head back, okay?
Right here.
Okay.
And that's the result of.
Relax this leg.
And that hurts when I cross my legs. I can't cross my legs. That
Yeah.
leg.
You got a bruise here on your knee, too.
Yeah, that's the bruise.
And a scrape.
Yeah, that
So-
might have been a result of the same thing.
Okay, so just relax this. So I want you to bend it as far as you can right now.
Bend it this way?
Yeah, as much as you can till it hurts. You can bend it all the way. Does it hurt? Do you feel pressure? Do you feel pressure?
It feels all right. I don't think
Okay, straighten it out a little bit. All right. Yeah, there's some swelling from the fall.
Here.
Yeah, there's some swelling from the fall.
Yeah. Is it
Yeah.
a bruise?
There's a bruise and a scrape there, yeah. But, whether you have arthritis there or not, You know, that I don't know. We would have to take an x-ray of your knee. But remember we looked at the scan of your feet?
Yeah.
So
Is it
when
good
you're
or bad that I got
flat-footed,
arthritis?
that causes you to invert or, kind of bring your knee in medially,
Yeah.
right? And that can cause premature arthritis too. So that's something I want to go over with you again, your foot
Okay,
scan, and
this was
show you
all
that.
arthritis.
Thanks for tuning in.